Welcome to Healthcare at the Edge, where we explore the intersection of healthcare and technology. My name is Samuel, and today I want to remember Dr. Martin Luther King Jr., the famous civil rights leader, activist, and pioneer here in the United States of America. Yesterday, on Monday, we celebrated a national holiday remembering him and the great work that he was a part of, that he really helped to lead and shepherd, and really brought our nation forward in a lot of critical areas. The work is still to be done. There is more work to do. We have a lot to learn and unlearn still. And one of the areas that I want to talk about when it relates to healthcare is how a person's zip code, a person's location can have a negative effect on their long-term health outcome. We call it a social determinant of care. Things that communities need will be different and will vary specifically based off of where they are or the makeup of that community or the people and the demographics there. So health systems must do better at getting access to healthcare into these communities that have lacked access to healthcare. It's a primary and priority thing for a lot of health systems, and they're making good strides and they're doing a lot of good things, but there's a lot more work to be done. It should not be the case that a person's zip code should determine their health outcomes. That needs to change in our health systems. So what can we do about that? Where does technology and healthcare come together to help make this problem more manageable? Well, one, we need to expand access to those communities. And we can do that in a lot of different ways, using the expansion of just clinics, doctors' offices, multi-specialty sites, even places that combine, community resources like social work or mental health or benefits or other things that help connect the community to necessary resources and also to their healthcare system in general. We need to use technology to enable and empower those sites. And many of those sites, the logistical burden of standing up a site is big, and then staffing it with technology staff as well, IT staff, is also cumbersome. So we have to use models and modes that allow us to deliver what we need to in those sites without increasing the burden on health IT in a onerous way. The second thing is I think telemedicine will be really crucial here, but there's a lot of engagement work that needs to be done for these communities to really embrace and then utilize telemedicine, not only for initial care, but for long-term and management care of whatever condition or chronic situation they find themselves in. So as I remember and reflect on Dr. Martin Luther King Jr., the man that he was, the leader that he was, and the work that he did in our nation, I'm both encouraged and humbled to say we have more work to do, but look how far we've come. So as we remember that, would we also look to see how healthcare and technology can continue the legacy of Dr. Martin Luther King Jr.? Hey, let me know what you think. I want to hear your comments, concerns, challenges, or critiques. Please leave them in the comments, and I'll see you tomorrow. Healthcare at the Edge is written and produced by Samuel Hill.